start with basic life support. Heart disease continued to be the leading cause of death in the United States. It's responsible for over 600 deaths, 600,000 deaths every year. Chain of survival, which begins with basic life support. Taking the right action quickly and confidently can make the difference between life and death for a person dealing with cardiac arrest. There are six components to the basic life support. One, quickly start the chain of survival. There is a way to do it, which we are going to explain both in adults and children. Second, very important is high quality chest compression to circulate oxygen to the brain and vital organs. And know when and how to use automated external defibrillator, which is easy. Every place needs to have AED, and how to provide rescue breathing and understand how to work with other rescuers as part of a team and know how to treat choking. These are all needs to be taught for every practitioner and healthcare workers across the globe and also to the common public. First, chain of survival. Early initiation of basic life support has been shown to increase the probability of survival for a patient experiencing cardiac arrest. The adult chain of survival, early initiation has been shown to improve the cardiac arrest. First, activate emergency response. When you see unresponsive patients, immediately call the emergency system. Then perform early CPR. It should not take more time in activating the response system since we most of us have the cell phones. You can put it in speaker mode and start early CPR while you are activating the emergency response system. Third, defibrillate with AED. We are going to go step by step. Fourth is advanced life support, post cardiac arrest care, and recovery care. In pediatrics, a little bit different because most common cause of cardiac arrest in adults is cardiac arrest. In emergency, children and infants are not usually caused by the heart. Children and infants most often have breathing problems that trigger cardiac arrest. So, preventing arrest is very important in pediatrics. Then activate emergency medical services, early CPR, advanced life support, post cardiac arrest, and recovery. So, a little different from adult chain of survival, follows the chain of survival because it has been evaluated and proven this line of action improves the outcome. First, we'll talk about BLS for adults. Number one, check responsiveness and ensure safety. Ensure the scene safety. Before approaching the victim, make sure the environment is safe for you and the patient. For example, if the patient had accident, you need to remove them from the traffic on the side. That is safe for the patient and for you, and also to you. Check responsiveness. Firmly tape the victim's shoulder and shout, "Are you okay?" to see if there is any response. Use the local language so that the victim can understand. "Are you okay?" may not be understandable for by all. Second one is activates emergency response system. If unresponsive, shout for help. Someone is nearby, ask them to call emergency services and get an AED. Calling emergency services and activate speaker mode if you're alone and have a mobile phone. Since most of us has a mobile phone, that can be done easily and simultaneously. So these are all the steps. Unresponsive, no breathing, or only gasping. Gasping is not counted as breathing. So that's also unresponsive. Activate emergency response and get AED and start CPR. And monitor the rhythm, the shock if needed, and the AED advise you to give a shock or not. And repeat every 2 minutes. In between, push hard and push fast. That is most important thing you need to do. Every 2 minutes the cycle repeats till the emergency medical services arrives. Assess the breathing. Look for normal breathing. Observe the chest for rise and fall. Listen for normal breathing sounds. If the patient is not breathing or only gasping, begin CPR immediately following adult BLS, basic life support algorithm, which we showed you before. Begin high quality CPR. Chest compression. Place the heel of one hand on the center of victim's chest. Just do it in the lower half of the sternum. Place your other hand on top, interlocking your fingers. Keep your arms straight and shoulders directly over your hands. I'm going to show you the picture. Please follow that one.
உனக்கு யூஸ் டிஎல்எஸ் மீட்டிங் அட்டெண்ட் பண்ணா உனக்கு சர்டிபிகேட் தருவாங்க நாயே
And compression depth, at least 2 inches, 5 centimeters. In adults, the compression supposed to be 5 centimeters. The compression rate, 100 to 120 compressions per minute. Allow full chest recoil after each compression. How often you need to breathe? After 30 compression, open the airway using head tilt and chin lift. I'm going to show you how to do that one. Pinch the victim's nose closed and give 2 breaths. The breaths needs to be given over 1 second, watching for chest rise. It's an important component. You need to give full breath over 1 second and watch for the chest to rise. Avoid excessive ventilation to prevent complications. Attach the AED as soon as it is available. Follow AED prompts. Turn on the AED and follow the voice instructions. Pair placement. Apply AED pads to the victim's bare chest as indicated. We will go in that one very detail. Just to stay with me. Analyze the rhythm. Usually the AED, automated external defibrillators, analyze the rhythm. During that analyzing time, there is no one should be touching the victim. Deliver the shock if advised. Shock is advised. Ensure everyone is clear, very important, and press the shock button. Resume CPR immediately after shock. There should not be any delay between the shock and resuming CPR. Continue CPR starting chest compression following adults BLS algorithm. Cycle ratio should be 30 compressions followed by 2 breaths. 30 compression followed by 2 breaths. Minimize interruptions. Keep pauses in chest compressions less than 10 seconds. Reassessment. Do not stop to check for pulse or breathing until emergency services arrive or the victim shows signs of life. Okay, only one person is available. The patient is unresponsive. There is only one person is there. So what kind of BLS, basic life support, one can give? Number 1, be safe. Make sure the scene is safe before proceeding. Move the person out of traffic. Move the person out of water and dry the person. Drowning person should be removed from the water and dried off. They should also be removed from standing water such as puddles, pools, gutters, etc. Be sure you do not become injured yourself because you are there to help him or help her. Assess the person. Shake the person, tap their shoulder hard and talk to them loudly in their language. Checks to see if the person is breathing. Agonal breathing, which is occasional gasping and is ineffective, does not count as a breathing. So agonal breathing considered as no breathing. Once ascertained the patient is unresponsive, call emergency medical services. Send someone to help or call your emergency number to get an AED. If you're alone, call for help while assessing for breathing and pulse. The latest recommendation says use speakerphone in your mobile phone or cell phone. Begin sets of compressions and rescue breaths, which is 30 compression followed by 2 breaths. Defibrillate. Attach the AED pads when it is available. CPR steps. Cardiopulmonary resuscitation steps. Check for the carotid pulse. The next slide, I will show you the picture how to do that one on the side of the neck. Keep in mind not to waste time trying to feel for a pulse. Feel for no more than 10 seconds, 5 to 10 seconds, you should ascertain. If you have any suspicion, go ahead and start the CPR. If you're not sure you feel a pulse, begin CPR with a cycle of 30 chest compression and 2 breaths. Use the heel of one hand on the lower half of the sternum in the middle of the chest. Put your other hand on top of the first hand. Straighten your arms and press straight down. Compression should be 2 to 2.4 inch, that is 5 to 6 centimeter into the person's chest, with a rate of 100 to 120 compressions per minute. Be sure between each compression you completely stop pressing on the chest and allow the chest wall to return to its natural position. Leaning or resting on the chest between compression can keep the heart from refilling in between each compression and make CPR less effective. It's very important. Number one, you should not bend your elbows. Number two, you need to give at the rate of 100 to 120 compressions per minute, and don't lean or rest on chest compression. Between each compression, the chest should
Okay, sir.
completely return to its normal position. So this is the way you feel carotid pulse. You should take only 5 to 10 seconds to do it. If you're unsure, go ahead and start CPR. So this is the way, put one heel of the hand on the lower 1/3 of the sternum, and the other hand should interlock it with the first one and do the chest compression by 5 centimeter depth. After 30 compressions, stop compressions and open the airway and tilting the head lift and chin lift. I will show you how to do that. Put your hand on the person's forehead and tilt the head back. Lift a person's jaw by placing your index and middle fingers on the lower jaw and lift up. Do not perform head tilt and chin lift maneuver if you suspect person may have neck injury, especially after traffic accidents. Don't do the head tilt and chin lift. That might cause more spinal injury they already have. In that case, jaw thrust is used. For the jaw thrust maneuver, grasp the angle of the lower jaw and lift it up with both hands, one on each side, moving the jaw forward. If their lips are closed, open the lower lip using your thumb. Give the breath while watching the chest rise. That is very important. Repeat while giving the second breath. Breath should be delivered over 1 second. Too important. The breath should be delivered over 1 second, and make sure the chest rises while you are giving the breath. Resume chest compressions. Switch quickly between compressions and rescue breaths. That should minimize the interval between these breaths and chest compressions. So this picture shows feeling carotid pulse, how to keep your hands in the lower half of the sternum, and the compression should be 5 centimeters. This is an adult basic life support, 5 centimeter, 5 to 6. And this is head tilt and chin lift. Head tilt, chin lift. If you suspect spinal injury, Jaw thrust. Pull the jaw forward. So if you have 2% basic life support, what we need to do? The second rescuer prepares for AED for use. You begin chest compression, the first one, and count the compressions out loud. The second rescuer applies the AED pads. The second rescuer opens the person's airway and give rescue breaths. The details needs to be different for the first. You cannot switch because there will be confusion if you do that. Switch roles after every 5 cycles of the compression and breath. The second rescue will become first and the first will become second, so on and so forth. One cycle consists of 30 compressions and 2 breaths. Be sure between each compressions you completely stop pressing on the chest and allow the chest wall to return to its normal position, natural position. Leaning or resting on the chest between compression can keep the heart from refilling in between each compression and make CPR less effective. Rescuers who become tired may tend to lean on the chest more during compression. Switching roles helps rescuers perform high quality compressions. The normal recommendation is after 5 cycles, you need to switch the person who is doing CPR. Quickly switch between roles to minimize interruptions in delivering chest compressions. When the AED is connected, minimize the interruptions of CPR by switching rescuers while the AED analyzes the heart rhythm. If a shock is indicated, minimize the interruptions in CPR. Resume CPR as soon as possible. Adult mouth to mask ventilation. Give 30 high quality chest compression. It needs to be practiced. It won't come when there is a situation. So it is better to prepare healthcare providers, everyone, including physician, nurses, respiratory therapists, and then everybody involved in the paramedics need to do more and more so that when the time comes, you are ready to use your skill. Seal the mask against person's face by placing your fingers of one hand across the top of the mask and the thumb on the other along the bottom edge of the mask. Use the fingers of your hand on the bottom of the mask, open the airway using head tilt and chin lift maneuver. Do not do this if you suspect the person have neck injury. Press firmly around the edges of the mask and ventilate by delivering breath over 1 second as you watch the person's chest rise. Important thing, when you give breath, head tilt chin left or jaw thrust and give breath over 1 second and watch the person's chest rise. So this is the way do the mouth mask ventilation. Put that mask, it need to be sealed tightly. Then by head tilt and chin lift, that's what he did. And he's giving a full breath and while watching the chest rise. So back mask ventilation in two rescuer CPR. Deliver 30 high quality chest compressions while counting out loud. So when you do the chest compression, whoever does, it needs to count so that everybody knows. The second rescuer holds a bag mask with one hand using thumb and index finger in the shape of C on one side of the mask to form seal between the mask and the face, while other fingers open the airway by lifting the person's lower jaw. The picture I want to show you in the next slide. The second rescuer gives 2 breaths over 1 second each as you watch the person's chest rise. Practice using the bag valve mask. It is essential to form a tight seal and delivering effective breaths. If the seal is not tight, the breath will not be that effective. The effectiveness you will see by looking at the chest rise. Chest compressions. So this is called C, finger C, kind of it's to seal the mask. Then here is the second rescuer give the full breath over 1 second, looking at the chest wall rise. So criteria for high quality CPR: start chest compressions hard and fast within 10 seconds. Allow for complete chest recoil between compressions. Minimize interruptions between chest compressions. Assure that the breaths make chest rise. Do not overventilate. That's reason 30 and 2. And assess for shockable rhythm as soon as AED available in witnessed cardiac arrest, as it is most likely a shockable rhythm in adults. So when you see the patient unresponsive without normal respirations or agonal respirations, call 911 in the United States and whatever the number you have in your area and get AED, assess the pulse within 5 to 10 seconds, administer one breath every 5 to 6 seconds, assess the pulse every 2 minutes, and start cycles of 30 compressions and 2 breaths. When you have an AED, assess for shockable rhythm. Administer one shock and resume CPR immediately for 2 minutes. Resume CPR immediately for 2 minutes and assess the rhythm every 2 minutes. Continue the steps until advanced cardiac life support providers arrive or until the person shows signs of life or return of circulation. So you need to continue that one. So how to use AED? AED is a device that recognizes ventricular fibrillation and other dysrhythmias and delivers an electric shock at the right time. Be sure to move a person and yourself to a safe place before using AED. Electricity and water can be lethal when combined. May ensure the person is not wet. Quickly wipe dry or in close proximity to water before using AED. Very important. Don't injure yourself while you are resuscitating the other patient. Number one, retrieve the AED, open the case, turn on AED. Very important. Even though those are all so we do it in a unconscious way, but make sure open the case, turn on the AED. If wet, dry the chest. Remove medication patches if the patient has one. Open the AED pads, peel off packing, check for pacemaker or internal defibrillator. Don't put the AED over pacemaker or internal defibrillator. Apply the pads. Apply one pad in the upper right chest above the breast. The second one, the lower left chest below the armpit. Ensure the wires are attached to the AED box. Very important. Apply the pads in the appropriate places and make sure the wires are attached. Move away from the person, stop CPR, clear the person to make sure no one is touching any part of the victim. Let AED analyze the rhythm. If AED message reads, check electrodes, then ensure electrodes make good contact. If the chest is hairy, pull off pad and replace it. If AED message reads shock, be sure the person is clear by making sure no one is touching them. Press and hold the shock button until the AED delivers a shock. Resume CPR for 2 minutes, starting with chest compressions, and repeat the steps 1 to 10. So open the box and make sure the chest is dry and place the AEDs in the appropriate right upper chest and the left lower chest and make sure the wires are connected. Let's move on to basic life support for children 1 to puberty. For children for all age groups, the compression to breath ratio is 30 to 2 for one rescuer. If there are two rescuers, 15 compressions and 2 breaths. Just keep that in mind. The 30 compressions, 2 breaths, it is across the board. And if you have 2 rescuers in children, the number changes 15 compressions, 2 breaths. The depth of compression for children compress the chest at least one third of the depth of the chest. That translates into small children 4 to 5 centimeter and bigger children 5 centimeter. Adults 5 centimeter to 6 centimeter depth. One rescuer unresponsive child performs CPR for 2 minutes before you call EMS, which is a little different from adults. Adults call EMS and perform CPR. Here, perform CPR and call EMS before you go and look for an AED. One rescuer BLS for children. Tap and talk loudly to child to determine if they are responsive. The child does not respond and is not breathing or only gasping. Gasping does not count as breathing. Yell for help. If someone answers, send them to call 911 or the similar numbers in your geographical area in emergency medical services to get an AED. Assess for breathing while simultaneously checking for child's carotid pulse on the side of the neck or femoral pulse, which is a little different from adults. In adults, just carotid pulse. In children, carotid pulse or femoral pulse. On the inner thigh, in the crease between leg and the groin, that's where you check the femoral pulse for 5 but no more than 10 seconds. If you cannot feel a pulse or if you're unsure, begin CPR by doing 30 compression followed by 2 breaths. If you can feel a pulse but the pulse rate is less than 60, you should begin CPR. This rate is too slow for a child. After doing CPR for about 2 minutes, usually about 5 cycles of 30 compressions, 2 breaths, and if other help has not arrived, call EMS while staying with the child. The ill code emphasizes cell phones are available, so one should do simultaneously activate the emergency medical system through the speakerphone while you are doing other elements of CPR. Get an AED if you know where one is, if it is available, where you are practicing or staying. Use and follow AED prompts when available while continuing CPR until EMS arrives or until the child condition improves. Tap and if there are 2 rescuers, tap and talk loudly to the child to determine if the patient is responsive. If the child does not respond, it's not breathing or only gasping, have the second rescuer call the 911 EMS and get an AED. Assess for breathing while simultaneously checking for the child's carotid pulse on the side of the neck or the femoral pulse for 5 but no more than 10 seconds. If you cannot feel a pulse or if you're unsure, begin CPR by doing 15 compression followed by 2 breaths. When there are 2 rescuers, 15 compressions and 2 breaths. If there is only 1 rescuer, 30 compressions and 2 breaths. If you can feel a pulse, but the pulse rate is less than 60, you should begin CPR. The rate is too slow for a child. When the second rescuer returns, begin doing CPR by performing 15 compression by 1 rescuer, 2 breaths by the second rescuer. Use and follow AED prompts when available while continuing CPR until EMS arrives or until the child's condition normalizes. So these are all the steps of pediatrics BLS algorithm. The criteria for high quality CPR: rate at least 100 to 120 compressions per minute. Compression depth 1/3 of the chest, which is small children 4 centimeter and bigger children 5 centimeter. Full chest recoil between compressions. Minimize interruption during chest compressions. Do not overventilate. Okay, when the patient is unresponsive without normal respirations, call 911 and get AED and defibrillator. Assess the pulse, 5 to 10 seconds. Weak pulse, administer 1 breath every 3 seconds. Add compressions if the pulse remains less than 60. With poor perfusion despite adequate oxygenation and ventilation. Assess pulse every 2 minutes. If there are no pulse, 1 rescuer begin cycles 30 compressions and 2 breaths. If there are 2 rescuers, begin 15 compressions and 2 breaths. When the AED arrives, Assess for shockable rhythm. If the AED message reads shock, administer one shock and resume CPR immediately. Then 2 minutes CPR and repeat the process. If the message says do not shock, resume CPR immediately for 2 minutes, assess the rhythm again, and continue the steps until ACLS providers arrive or PALS providers arrive until the person shows signs of return of circulation. Child ventilation, how do you ventilate the child? Make sure the mask is correct size for the child, which is a little different from adults. Adults, most of them have the same size. In children, depending on the age, the mask, the same size, doesn't fit all children. The mask should cover child's mouth and nose without covering the eyes or chin. Make sure it doesn't do that. Each breath should last 1 second and should cause child's chest to rise. Avoid giving breaths too quickly, as this may result in distension of stomach, vomiting, and possible aspiration of stomach contents. So each breath should last 1 second and should cause child's chest to rise. Proper position in the absence of neck injury, head tilt, and chin lift. Use the easy clamp method to make sure the seal is tight. And ventilate. Squeeze the bag over 1 second until the chest rises. Do not over-ventilate. This needs to be practiced, even though it looks simple. At the time of emergency, people tend to make mistake. If you practice over and over, you will do better resuscitation. That translates into outcome difference on the victim. BLS for infants 0 to 12 months. Check the pulse in the infants using brachial artery on the inside of the upper arm between the infant's elbow and shoulder. This is very different from adults and children. Adults carotid, in children carotid and femoral. In infant 0 to 1 year, first 12 months, the brachial artery inside the upper arm. During CPR, compressions can be performed on an infant using 2 fingers. If only one rescuer, that's 2 fingers, or 2 thumb encircling hands if there are 2 rescuers. The rescuer's hands are big enough to go around the infant chest. Compression depth should be 1/3 of the chest depth. For most infants, it's about 1.5 inches, that is 4 centimeters. So the depth should be 1/3 of the chest, which is 4 centimeters. If it is only one rescuer available, perform CPR for 2 minutes before calling 911 or EMS or using AED. Similar to children, CPR for 2 minutes before activating emergency medical services. In infants, primary cardiac events are not common. Usually, the cardiac arrest will be preceded by respiratory problem. Survival rates improve when you intervene with the respiratory problem as early as possible. Since we are moving into the winter or spring and winter, we are going to see lots of patients with bronchiolitis and pneumonia. So early identification prevents lots of cardiac arrest in children. Remember that prevention is the first step in the pediatric chain of survival. If you witness a cardiac arrest in infant, call 911 EMS and get EED as you get in the BLS sequence for adults and children. So how do you do that? First, check the pulse in infant in the inside of the upper arm for brachial artery. And if you're only one rescuer, use 2 thumb method to do the chest compressions. So you do at the middle of the chest to do the compression. If there are 2 rescuers, you can do the encircling hands to do the compression. So the one rescuer BLS for infants. Tap the heel of the foot and talk loudly to the infant to determine the patient is unresponsive or responsive. Assess if the patient is breathing, while simultaneously checking for infant's brachial pulse for 5 but not more than 10 seconds. If the infant does not respond, not breathing, yell for help. If someone responds, send the second one to call 911 or EMS and get an AED. Since most of us have a mobile phone, and call them directly from where you are. If you cannot feel a pulse or if you are not sure, start CPR, 30 compression followed by 2 breaths. If you can feel a pulse and the rate is less than 60, begin CPR. This rate is too slow for an infant. 60 beats is not good for an infant. To perform CPR on an infant, do the following. Be sure the infant is face up on hard surface. It's very important. If the surface on which the child is lying is so soft, your chest compressions will not be that effective. Using 2 fingers, perform compressions in the center of the infant chest. Do not press at the end of the sternum. This may cause injury to the infant. So you have to be a little bit above the end of the sternum to prevent the injury. Compression depth should be 4 centimeter and the rate is 100 to 120 compressions per minute. If you look at it, the compression rate is the same across the board, whether it's adult, pediatrics, or infant. Perform CPR for about 2 minutes using 30 compressions and 2 breaths. If help has not arrived, call 911 at EMS and get an AED. Use and follow AED prompts when available while continuing CPR until EMS arrives or until the infant condition normalizes. This is the way you do it. Feel the pulse. Do with the 2 fingers. If you're alone, if there are 2 rescuers, use encircling thumb around the chest. If there are 2 rescuer BLS for infants, tape the bottom of the feet and talk loudly to determine if the patient is responsive. If the patient does not respond, call EMS 911. The second rescuer does it. Assess if they are breathing while simultaneously feeling the pulse for 5 but not more than 10 seconds. If you cannot feel a pulse or unsure, there is 2 people, 15 compressions followed by 2 breaths. If you can feel a pulse, the rate is less than 60, begin CPR, 15 compressions and 2 breaths. When the second rescuer returns, begin CPR, 15 compressions followed by 2 breaths. If the second rescuer can fit their hands around the infant chest, perform CPR using 2-thumb encircling method. Do not press on the bottom end of the sternum as this can cause injury to the infant. Compression should be approximately 4 centimeter deep at the rate of 100 to 120 per minute. Use and follow AED prompts when available while continuing CPR until EMS arrives or until the infant condition normalizes. AED for children and infants. Open the pediatric AED pads. Peel off packing. Check for pacemaker or implanted defibrillator. And also VNS, vagal nerve stimulator, don't put on top of them. That can cause cardiac arrhythmias or other aberrations. Apply the pads. Apply 1 pad on the upper right chest. For infants, apply on the front of the chest because their chest is so small. The second pad goes to the lower left chest in bigger child. In infants, apply on the back. In infants, very easy. 1 in the front, 1 in the back. For others, right, upper right chest and the lower left. Ensure wires are attached. Move away from the child. Stop CPR. Instruct others not to touch the person. Let AED analyze the rhythm. If the AED says check electrodes, then ensure the electrodes are in good contact. If the AED message says shock, press and hold the flashing shock button until the shock is delivered. And resume CPR for 2 minutes, starting the chest compressions. The same way, make sure the chest is dry and the infants use front and back, and in bigger children, right upper and the lower left chest, similar to adults. And make sure the electrodes are attached and connected to AED. Airway management. Until an advanced airway is inserted, what is advanced? The team should use mouth to mask, or bag mask ventilation. What is advanced airway? Supraglottic airway, laryngeal mask airway, or endotracheal tube. That provides more stable way of providing. Till the advanced cardiac life support comes to your side or available. Continue mouth to mask, or bag mask ventilation. The compression to breath ratio. In adult, 30 compressions followed by 2 breaths. 1 breath every 6 seconds without pauses in compressions. When you have an advanced airway, you don't have to stop compressions while you are giving breath. You can even simultaneously, but the breath need to be given every 6 seconds. That means 10 breaths per minute. When you're doing child infant, 30 compressions followed by 2 breaths for 1 rescuer. If there are 2 rescuers, 15 compressions followed by 2 breaths. But if you have an advanced airway, 1 breath every 6 seconds without pauses, or 1 breath every 2 to 3 seconds, that will count as 20 to 30 breaths per minute. The smaller the children, the higher the breath rate. The mouth to mouth rescue breathing, adults and older children. Open the airway using head tilt and chin lift. Pinch the person's nose closed, your hand on the person's head. Create a seal when using your lips to surround the person's mouth. Blow into the person's mouth for 1 full second and watch for chest to rise. Tilt the victim's head further back if the chest does not rise. So always see the chest rise. If it doesn't rise, tilt the chest a little bit, just open the airway. Give an additional breath for 1 second. If you cannot see the chest rise in 2 breaths, continue giving chest compressions. So this is the head tilt. Pinch the nose, seal tightly over the face, over the lips, and give a full breath. If the chest doesn't rise, just tilt the head a little bit more. Open the airway using head tilt treatment, but be sure not to hyperextend the neck. When you do a hyperextension, that again obstructs the airway. Create a seal using your lips, surround the infant's nose and mouth. Gently blow into the infant's mouth for 1 second. Keep in mind, the infant's lungs are smaller than adults and need a smaller volume of air. Watch for infant chest rise. If you cannot see the chest rise, readjust the tilt of their head. Give an additional breath and watch for infant chest to rise. If unable to cover both mouth and nose entirely with your mouth, use the following method for rescue breathing. Open the airway using head tilt and chin lift. Pinch the infant's nose. Create a seal using your lips to surround the infant's mouth. Gently blow into the infant's mouth for 1 second. Give an additional breath and watch for the chest to rise. So this is typically, it's available here in the United States. You usually use a polythene paper with a hole in the middle that then you seal and give a breath over 1 second and look for the chest to rise. The rescue breathing in adults every 6 seconds, that is, translates into 10 to 12 breaths per minute. Child and infant, 1 rescuer, 10 to 12 breaths per minute. 2 rescuers, that means breathing every 15 to 2, translate into 20 to 30 breaths per minute. Each breath should last 1 second, and make sure chest rise is observed while you are giving a breath. Finally, relief of choking. The choking can be mild or severe. If it is a mild obstruction, breathing but may also be wheezing. The patient will be breathing but may be wheezing. The coughing and making noise. Stay with the person and try to keep them calm. Encourage them to cough and call the emergency medical services or send the patient to the hospital. When there is a severe obstruction, the clutching of the neck, this is a universal sign if you have a severe obstruction. They will not have cough or weak cough, unable to make noise, That means it is the obstruction somewhere in the upper airway. Unable to make noise or may make high-pitched noise, little or no breathing may be cyanotic. These patients use severe abdominal thrust to attempt to remove the obstruction in adults and bigger children. Call 911, begin BLS. If the patient becomes unresponsive, begin BLS. If the patient is responsive, abdominal thrust. This is for adults and bigger children. So how to do abdominal thrust? Stay behind the responsive person. Wrap your arms around their waist until their rib cage, under their rib cage. Put the side of your fist above the person's navel in the middle of their belly. Do not press on the lower part of the sternum. It has to be between the sternum and the navel, in the middle of the belly. With your other hand, hold the first fist and press forcefully into the person's abdomen up toward their chest. Continue performing these thrusts until the obstruction is relieved or until the person becomes unresponsive. So this is the way you do it. Just keep the fist between the rib cage and the navel. Then use the other hand, put forcibly up and above till the obstruction relieved or the patient become unresponsive. In infants, a little different. Mild obstruction, the patient will be breathing, maybe having wheezing, maybe coughing and making noise. Stay with the infant, try to keep him calm. Do not do a blind finger sweep, which we used to do. Do not do that. Call activists, the emergency medical services. When there is a severe obstruction, weak or no cough, unable to make noise, may make high-pitched noise, little or no breathing, may be cyanotic, blow around the lips and fingers. Use back blows and chest thrusts to attempt to remove the obstruction and activates emergency medical services. If the patient becomes unresponsive, begin basic life support. If the obstruction is visible, and remove it. So how to do back blows and chest thrusts? Hold the infant in your lap. Put the infant with their face down and their head lower than their chest. They should be resting on your forearm. Put your forearm on your thigh. Support the infant's head and the neck with your hand and be sure to avoid putting pressure on their throat. So very important, when you are holding the patient, you should not put a pressure on their throat. Using the heel of your free hand, deliver 5 back blows between the infant shoulder and blades. I'm going to show you the picture. Using both the hands and arms, turn the infant face up so they're now resting on your other arm. This arm should now be resting on your thigh. Make sure the infant's head is lower than their chest. Very important. In both the situations, the head should be lower than the chest. Using the fingers of your free hand, provide 5 quick downward chest thrusts. Back blows first, chest thrust, 5 of them. Perform the thrust every second. If the obstruction is not relieved, turn the infant face down on your other forearm and repeat the process. Continue doing this process until the infant begins to breathe or become unresponsive. So this is the way you do it. This is back blows. Back blows you do between 2 blades of scapula in the middle of the upper body of the child. So when you do that one, make sure the infant head is downward, chest is up, so that the obstructions will be relieved. After 5 thrusts, after 5 back blows and move the chest, the friend do the chest thrust the same way. Again, hold the child's head should be lower than the chest.